what measures are you taking to improve or maintain quality and compassionate healthcare delivery, which is like a trademark of our organization?
The measure that I'm taking, first and foremost, personnel development. Quality care comes from quality staff. You cannot give out what you don't have. You can only perform to the level of your ability. So if we train our staff and always give them in-service training, they will perform. They will give you quality service. 2, quality equipment and quality diagnostic equipment especially. If you have quality staff and you have quality equipment that is not just breaking down every now and then, or the absence of it, will not give you quality care. So you must have quality equipment that can diagnose accurately. That wrong diagnosis will lead to wrong treatment and it may lead to death. So we need to have that. 3, good infrastructure adapted to services. You know, there are some facilities that are not accessible to people on wheelchairs, not accessible to people with disabilities and so on. We need to have infrastructure that is well adapted to the kind of care you want to give. In terms of how it is laid out, and also in terms of the ample space where people circulate. Where you have congestion, there will be infection. There will be poor performance by the workers. Because they are not able to, you get tired when you're working in a tight environment that is not conducive to the kind of services that you want to offer to the people. And 4th and lastly, good leadership. All of these that we are saying are coordinated by leadership. If we don't have good leadership, all what we are saying like this will end in nothing. Good leadership guarantees good environment, enabling environment for performance. Good leadership stimulates and motivates the staff to perform. Good leadership guides and directs the staff towards stated goals and objectives of the organization. Good leadership is accountable for the resources of the organization and ensures that resources are used to maximum to achieve stated objectives of the organization. So if you have this in place, the mission statement will be maintained, the vision statement will be maintained, and of course, there will be sustainability.
You are on record to have said the health industry is the most complex to manage. What exactly do you mean?
The health industry is a system that is very, very complicated and complex. It is made up of different specialties. That's the first thing. All these specialties have their demands. Then, of course, globally, what do you put into this to make it work? You put in finances, you put in drugs, you put in equipment, you put in personnel, you put in buildings. If leadership is not competent enough to coordinate all these resources in a timely manner and to ensure that they are in the right proportions and consistently, because it's not a one, you know, when you go and build a classroom for children to study and you put in benches and you have a blackboard, the only thing you should need every day is chalk and a teacher. It's not the same thing with a ward. We build a ward for patients. Is that all that you need? No. You need those nurses there. You need medication every day. Medication every day. You need sutures, that medical supplies. You know, when you talk of drugs, there are medical supplies, and before there are equipment. You need this every day in the right proportion, the right ones and the right proportion. Somebody has to have an eye on this throughout. Now, if you have a store for those things, that's another area of responsibility, because somebody has to have an eye on that store to be sure, first, that the things are there, two, that the things are safe from pilferage. And then, of course, the ward that you're talking about, the ward needs 5 workers. When you put in the 5 workers, is that all? No. Somebody has to supervise them to ensure that the 5 are all doing what they are going to be doing on the 20 patients in that ward. Those 20 patients are not stagnant, or the only patients that have to be in that ward. Before the end of the day, some might have left and some have come. That's a lot of responsibility for those 5 people. And somebody has to supervise those 5 people. And somebody has to supervise the person who's supervising the 5 people. And then, you want to balance even the needs of the entire hospital, because the hospital is not made up of only that one ward. You have several wards at the hospital. The hospital is not made up of only wards. Registration, finance, administration, all of these wards, theaters, and all of this and so on. And they all need different things to function well. They go to where they collect money. Money is sweet and tempting to everybody. Somebody has to have an eye on that every day to ensure that what comes in and is recorded is actually what has been collected, and that is going to the right place. And the person receiving in that place, the receiving it there too, takes care of it well and accounts for it well, so that at the end of the day, all what came in from 10 different places in the hospital, or 5, has gone into one place, and into that one place, who is there that is ensuring that it is well accounted for, to be channeled to the next level again, before it starts coming back again, because you have to come back either for purchases, for payment of salary, for payment of this and so on and so forth. This is the complexity of the health system. No, but that is not it yet. It's not ending there. That hospital that I'm talking about is part of a system of hospitals, of health centers that have to be coordinated to knit into one department, which is health services. But that's not all. It is part of a system in the country with regulations. With regulations, the Ministry of Health that coordinates this has regulations for private health, for public health, for this, and each of the departments. You have to work within that kind of a system of care, that the government has policies on what should be done, and yet you also have policies as an organization. How do you balance the two? How do you balance the two to ensure that there are no conflicts, there are no clash? You don't kind of violate state rules, state demands on you, and so on and so forth. Then, of course, you're balancing again the community needs and the system needs. What is it that the community wants, and what is it that you can offer to the community? It is a complex structure which you have to have an eye on every day. Your mind has to be ticking every day, and you are looking this way, that way, this way, this way, this way, and so on. And is everything moving well and towards the right direction for quality care to everybody that needs it? Is it what everybody needs? Is everybody able to pay for that? If you offer what they need, are they able to pay for it? And if they don't pay, do you give it to them or you don't give? If you don't give it to them, what happens to them? If they die because you are not able to give it to them, are you actually fulfilling your mission statement, that you seek to to assist in the provision of healthcare to all, ALL, to all who need it. How do you provide care to all when some people have no money to pay for it? And then, how do you say you're providing healthcare to all when you have excluded some people because they cannot pay for it?
Prof, what are your greatest joys and fears as Director of CBC Health Services, and why?
My joys? You want me to count all to you? Do you have enough time? The first one is just that at the end of the day, God is glorified. At the end of the day, people are receiving services. At the end of the day, my workers are happy because they are able to put food on the table for their children in the homes where they are. My joys are that the community realizes that what we are doing is important and that we are assisting in the provision of care to all who need it. My joy is that we are still able, even at a time of crisis such as this, to pay salaries to everybody. We are still able to provide services to people in Queen, in BBH, in Bingo, in Mutengeni, in Bopi, Yaoundé, Marwa, Meskin, in Marwa, and I hear the attendance is only going up in all these places. If you go to a hospital and you get the services and they are good, you will tell somebody that those services are good, and that person will come. I think that's what is happening. If you go and they are bad, you're going to say those people don't know what they are doing, and other people will not come. The fact that people continue to stream into our facility gives me joy because I believe that they are saying what we are doing is good. It's an approval of what we are doing. And so I believe my joys are really those that if you want to count, I would say my blessings are like those of Abraham. Abraham's blessings are mine. And that the joys are just overflowing, and I see them overflowing to my staff, to my workers, because they make me feel happy. They are the ones I'm happy. In fact, if I'm here doing what I'm doing, it is thanks to my staff, because they actually lift me. You know, they are holding on my hand and saying, continue, do it more again, and so on. And I'm happy with that. And you know it yourself, you know it. You know that because we are together as a department, as a board, and everybody doing what we're supposed to be doing, they are saying that we are second to government and that we are the best. It is because all of you are supporting each other. You are not undercutting each other or piercing each other or backstabbing or doing this and so on. In as much as we continue to remain united and to work like one department, our joy will overflow. You will always find what you want and you will be happy. Have you ever had an occasion that concerns you, whether it's a marriage, it is a death, it is a graduation? Do you see the way our people turn out and stand by you? Have you seen? When they come like that, how do you feel? A big family, family of God. These are my people. One of my doctors lost the father last year. He came and told me and said that tears were coming out from his eye like this. When he turned like this, there are just his people. Turn this way, just the workers of her, but that way, behind him, they are just there. That when he wanted just to hold it, no, doctor, leave it, we'll do it for you. Wanted to hold it, doctor, no, leave that one, we'll do it for you. And then he found himself just floating. God saying, well, thank God that I belong to a system like this. I did not know that this is the kind of a family that I have. What else can be more important than that? Whenever I have had anything to do, oh my goodness, I have always said, if there's one person in Cameroon that has the biggest family, it is me. Because when I turn and see all of you like that by me, I am just smiling. I say, thank you, God, that I belong to this particular department. I belong to this department. See people smiling. They are not doing like out of fear or out of a way of bribing me so that I should do something for them. No. They are doing it that this is our brother. This is our father. This is part of us. And I feel happy about that. I really feel happy about that. Don't do anything to me because you're afraid. I will not do anything to anybody. Don't. I am instead happy that you are there and serving God, and that God is glorified in what all of us are doing. So that is a lot of joy. What other joy do you want me to have? No, this is more than enough.
Any fears?
And I'm in the right place. No fears.
Okay.
Look, the system we are put in place there is a system that is going to stand today and tomorrow. But when I turn around and see young people like you people, I know that there's a future. I know that there's a future. When I visualize, starting from Miskin in Marua, coming through Banyo, coming through Nguso, Bakusam, and I go up towards Nkambe, go back to Yaoundé, go through Douala, come through Southwest, move all around. I see in each of the institutions a core of people that are competent and capable of moving the system into the future, 100 years from now. No, not that there's somebody in the system now that will live 100 years again, because none of you here will still live 100 years. But at least I'm saying the system will remain into even 100 years. Because those that are there now will continue to mentor other people that are going to continue, will be handling. You run the relay race. You run you give and so on. So there are people here. I will hand over to some of you. You hand over to the next. You hand to the next, just like that. And when you are handing what? You are handing values. You are handing what we have lived for. You are handing a system that works, a system that functions, and you want people to continue to move it ahead. There will be people who will talk maliciously. They will always be there. And that's what we should be aware of. That there will be people that will talk that way. So when they talk, we should not be surprised. We should educate them, love them, and help them. Bring them from this negative to the positive. That is social change. Social change. Move them from this negative to the positive and ask them to become your ally. Let them join you in what you are doing to help the people. If that happens, you have succeeded by winning that person from a negative position to a positive side of the game.